I'm Dimitrakopoulou, currently a visiting assistant professor and a Marie Curie Global Fellow at the MIT Media Lab and the University of Zurich. And the work I will be sharing with you today originates from my ongoing study on misinformation around vaccination, in which I'm tuning into people's lived experiences as a means of understanding and lifting up patterns of information consumption, trust, and decision-making ahead of the COVID-19 vaccine. So I'd like to start with the story of Laura, a 35-year-old mother of two. When she was 24, the Gardasil vaccine had just came out, which was to prevent HPV. When she requested to get one from her doctor, she did not agree as she didn't meet the requirements. She was married and at the age limit for the cutoff. Almost 10 years later, she went to see the same doctor only to receive her cancer diagnosis from HPV. The name of that person is made up, but the story is not. It's one of the dozens of stories that we're inviting people to share in a large series of focus groups on vaccination, especially within the context of the ongoing pandemic. We ground our work on the assumption that everyone has a story and harness the power of stories as a means of understanding different hopes and concerns around the future COVID-19 vaccine and people's trust in media and social institutions. The goal of this study is to gain insights into the kind of information and data that are most valued and needed to support an informed decision on future vaccination. With a focus on community-powered storytelling, we're hosting facilitated dialogues with more than 150 participants in 30 focus groups. This is a work in progress, and I will share with you today our line of thought and first insights that are emerging. In the focus groups, we're building on the principles of dialogue to create a space in which different perspectives, beliefs, and experiences are shared. The participatory experience of the people joining is supported by a visual scaffold that helps dialogue to evolve organically, facilitates group learning and a connection, and creates a visual memory of the conversation. In this process, participants are joining the dialogue with diverse and really creative ways to share how they're experiencing the pandemic in this moment and how their lives have changed over the last months. And through a brainstorm, they're bringing their awareness to different hopes and concerns around the future COVID-19 vaccine, while reflecting on their choices and different concerns that they're having. This way, we're able to organize prominent themes that emerge through the discussion. What we notice is that the vaccine is closely related to the hope of returning back to normal and finding a cure, while issues related with the vaccine that is delivered soon in an affordable cost and that is widely available are highlighted. Interestingly enough, similar themes emerge when people tune into their concerns and challenges, stressing issues such as access, effectiveness, and the timely distribution of the vaccine. And while a lot of hope is invested in a fast-track COVID-19 vaccine as a way of returning to a new normal, the fast-track vaccine raises concerns and hesitations in regards to its safety. By focusing on the levels of trust that people have in media and social institutions, we observe that the major ones end up at the outer circle of the least trust. This lack of trust, when combined with prior lived experiences, can offer us a threat that can help us understand how individual experiences result in different biases and misconceptions that lead people to rely only on themselves when looking for information around health issues and taking decisions that affect their family's well-being. What we observe is that the lack of trust in official authoritative voices result to people feeling torn and more confused. Humane, personal stories seem to matter most, and where statistics and big data fail, simpler, relatable information in visual form that is easier to remember and comprehend can help people make sense of all the conflicting and overwhelming information that is out there. In a crisis like this one, people are alarmed, they have mixed emotions and feelings, and they need to make sense of what is happening in order to feel that they have control over their actions and decisions, over their lives. During this pandemic, people are struggling to make sense of a problem that is just too big and too complicated for anyone to fully comprehend. To satisfy that need, they're looking for answers, which means that they look for information. If the authorities cannot satisfy their desire to know more, this void will be filled by others, often with rumors, misconceptions, resulting to misinformation. One way to fight misinformation is to try to fill this void with even more data, hardcore facts from scientific sources and experts that embed the information with authority. But if people don't trust them, this doesn't really solve the problem. With narratives that matter, are relatable, simple, and clear, we can try to close the loop. In a society of ailing trust, it's important to be reminded that trust-centered networks among all parts of the community is what matters the most. To do that, we need to explore patterns of pluses, minuses, and deltas in the ways we interact with each other and our social institutions. Embracing the values of diversity, empathy, and inclusivity, we can relay the vision of trust-centered journalism that can help approach our complex reality, but by first zooming out and study how our world works through a systems thinking lens, and then zoom in to people's lived experiences as a means of connecting to inspire empathy and foster personal growth, one dialogue at a time. Thank you so much for your time, and I'm open to any questions you may have.